I'm happy to go ahead and get started. My name is Shannon Redor, and I am a pediatric nurse practitioner. I've been practicing for about 12 years. And today I wanted to discuss the effects of COVID-19 on the African American community, as well as address vaccine hesitancy, which is impacting the decision to get vaccinated. Today, I will be presenting with Dr. Nanton Donato, and unfortunately, Dr. Carragher was unable to join us on today. He had to attend a funeral of his father-in-law, who unfortunately passed of COVID-19. Next slide, please. First, I think it's important to know that the choice to get the vaccine is yours and it's a personal choice. I'm a strong believer that this choice should be an educated one, made after doing your own research and asking your questions, which is why I think this town hall is so imperative. It's important to understand that getting back to normalcy is a group effort. This pandemic affects the world, not the US alone. This slide illustrates how COVID has affected people in the world. Next slide. In Minneapolis, as of April 12th, there was an average of 23 cases a week, which unfortunately is an increase from only a month ago when we were averaging 1,000 cases a week. This is revealing, showing us that we are not out of the woods yet, and there's a lot of work that needs to be done to get this pandemic under control. Next slide. People of color are overrepresented in severe coronavirus disease. The COVID-19 pandemic has highlighted health inequalities that have existed for many years. Recent data shows that Black individuals are 3 times as likely to be hospitalized and twice as likely to have died of COVID-19 as white Americans. Next slide. So you may ask, why the increased risk? Long-standing systemic health and social inequities have put many racial and ethnic minority groups at increased risk of getting sick and dying from COVID-19. People of color are disproportionately affected by COVID-19, and these disparities have also emerged among children. There are many common social and economic factors which were already in place before the pandemic that increases the risk of COVID-19 in the minority community. Things like living in crowded housing conditions, the results of longstanding racial residential segregation and prior redlining policies contributed to these crowded living conditions. It is difficult for 10 individuals living in a 3-room apartment to appropriately physical distance if one was to become infected. Also, working in essential fields is another risk factor. People working in environmental services, food services, and the transportation sector and home health cannot work from home. These positions put workers in close contacts with others, increasing their risk for contracting the disease. Furthermore, inconsistent access to healthcare due to the lack of insurance or underinsurance is a risk factor. Being able to afford doctor's visits, medications, and equipment to manage chronic disease is essential to lowering the risk and death of COVID-19 and other conditions. People of color have a higher burden of chronic health conditions associated with poor outcomes from COVID-19, included but not limited to diabetes, heart disease, obesity, and lung disease. Knowing this, a patient with badly controlled diabetes or asthma due to inconsistent treatment, for example, is at risk for severe, even deadly coronavirus infection. Also, it's important to note that the stress experienced by African Americans and other minorities in this country can impact the body's ability to fight disease. Studies have proven that stress has a physiological effect on the body's ability to defend against disease. Income inequality, discrimination, violence, and institutional racism contribute to the chronic stress in people of color that wear them down and wear their immunity down, making them more vulnerable to infectious disease. Next slide. We have all heard the term variants. What this means is the virus is changing or mutating. These changes sometimes makes the virus easier to transmit, and sometimes it makes people sicker. The virus is only able to change when there's a live host. So every time someone is infected with COVID-19, there's an opportunity for a new variant to be created. Of the variants listed here, it is the B.1.1.7 variant that has been found in Minnesota. This variant is infecting more young people and resulting in more severe disease. Next slide. So current methods to fighting the disease includes wearing a mask and social distancing. You should test when you're exposed or having symptoms. There are treatments such as monoclonal antibodies available for certain populations if you become sick, but really the vaccine is our best shot to controlling this pandemic. Next slide. So now Dr. Nanton Donato will discuss the vaccine.
Thanks, Shannon. So I am a family medicine physician. I'm also trained as a scientist in immunology. I got my PhD in immunology at the University of Minnesota, and I studied immune responses to infections. And the reason why I'm here today is because I really do think that vaccines are going to be our way out of this COVID-19 pandemic. What I like about good vaccines is that they greatly reduce the risk of infection by working with the body's own natural defenses to safely develop immunity to a disease. So we're not treating something, we're not reacting, we're being proactive with our body's own defenses. Next slide, thank you. So there are a few vaccines that are available to us in the United States of America. And some of these have some newer technologies that make people pause a little bit. And they're a little worried about getting this new kind of vaccine. So I want to tell you what goes into each of these vaccines. Two of them, one by Pfizer, BioNTech, and Moderna, use a technology called mRNA, or messenger RNA. And I do want to point out that although this is new technology for human vaccines, they've been used in research on animals for over a decade. So humans are not the guinea pigs here. Mice are, essentially. So what mRNA vaccine does is, mRNA is a genetic material that gives an instruction to our body on how to make proteins. And one of the proteins that is part of the coronavirus, COVID-19 virus, is the spike protein on the surface. And because it's on the surface, it's a really good target for the immune system. So they put this instruction just for one protein from the virus, not the whole virus, into a coating, kind of like a fatty coating, to help deliver this message to the body in the vaccine. Once the mRNA is in the body, our bodies use what we normally use to make our own proteins to develop the spike protein. Then once the spike protein is presented on our own cells, our body's immune system recognizes that it doesn't belong to us. So it starts forming a really good immune response that includes antibodies and other immune cells that can then recognize this spike protein and therefore the COVID-19 virus once we get exposed to the virus. One thing about mRNA is that it doesn't get integrated into our DNA. This is a message that is short-lived. So once it does its job of helping us create the spike protein in our body, it gets degraded by the body. And then once there's no more message for more spike protein to be made, that will eventually get degraded too. So it's a little snapshot for our body to get a taste of what COVID looks like and form a really good immune response. The other vaccine that is available in the United States is Johnson & Johnson vaccine. And this also delivers genetic material that gives our bodies the message to make the spike protein. How they deliver it into the body is a little bit different. So they use what we call adenovirus based vaccine. So adenovirus is not like the COVID-19 virus. It's a harmless virus where they put the genetic material just for one COVID-19 protein, the spike protein, and the body takes that up. It's one viral DNA that translates into the mRNA that we just spoke about in the last slide. And then this mRNA again makes our body, gives our body the message to make that spike protein. So our body produces a really robust response. This particular genetic material also gets broken down into the body without getting integrated into our own DNA. Next slide, please. Thank you. How many people were tested? How do we know that this is safe? Looking at the trials for Pfizer, Moderna, and Johnson & Johnson, these research studies included about 75,000 patients who agreed to either get the vaccine or a placebo. And then they looked at those who got the vaccine versus who got placebo, who got sick with COVID-19. They included people who had high risk for severe COVID-19 disease, like people with high blood pressure, heart disease, diabetes, obesity. And they also did try to include people from diverse communities, including people in the Black African American community, the Latino community. Next slide, please. And as a scientist who's trained in vaccines and looking at the immune response, I will admit to you that I was a little concerned when the presidential administration was talking about warp speed vaccines. I'm like, how can they actually do this? But what I found in the process is that they didn't take any shortcuts in the science or the safety. I looked back at all of the papers and how they developed the vaccine from each stage and how they tested it. And they actually did an excellent job at looking at safety and efficacy and the types of immune response. What happened in this long process is that they took out all the red tape. Never before have we seen such collaboration across the globe with scientists sharing information so that we have this one common goal of ending this pandemic by creating vaccine. Then funding is a huge issue in the scientific community when we're trying to come up with treatments, cures, vaccines. And that was taken off the table. So much funding has gone into this that we were able to take out the long years of writing grants and trying to get money for this type of thing. Also, people spoke with each other, scientists spoke with each other every step of the way. There's committees that get together and decide, should we go through with this? And usually we have to wait months and months for these committees to gather. They gathered right away. So we're seeing the speed in which we saw the vaccine come to fruition is because everybody was working together. Next slide now. So I like to tell my patients all the time, nothing ever comes without side effects. What we eat, what we put in our bodies, medicines we take, everything has effects we want as well as side effects. And there are some common side effects with the COVID-19 vaccines. Just like with other vaccines, pain and swelling in your arm at the injection site that lasts for some for a few hours, some for a couple of days. Some people may get tired, a little bit of a headache, muscle ache. Some people even may get chills and fevers for maybe a day or two. And those are really, truly the main side effects. And they're not really long lasting. For the Pfizer and Moderna vaccines, we have seen that younger people who maybe have even a more robust immune response may have these side effects more than older people, people older than 55. But these side effects are from your immune system getting up and working. create a good response to seeing COVID-19. Next slide. Thank you. So how well do these vaccines actually work? If we look at how well they protect against getting COVID-19 infection in general, Pfizer and Moderna are around 94-95%. Johnson & Johnson is around 72%. And this is from getting any COVID infection. But I would like to point out that all three vaccines actually will protect you 100% so far that we've seen against getting hospitalized and dying from COVID-19. And that's what we're trying to do here, save lives. One thing that just came out yesterday, because we're always, the CDC, the FDA, they're really closely monitoring the situation for safety concerns, is that the CDC and FDA came out with a recommendation to pause the Johnson & Johnson vaccine to investigate a rare clotting disease that has happened in 6 people out of the 6.85 million who have gotten the Johnson & Johnson vaccine. This is basically 1 in a million, but they're taking this so seriously that they want to investigate and make sure that this is still safe. Next slide. Although I guess I should point out also this rare clotting disease. Can you go back to the next slide? I'm sorry, the last slide. Thank you. So far, it's just 1 in a million cases, and they're taking that seriously. But I do want to point out that things that we may come across in everyday life have a higher incidence of clotting disease at this point too. Smoking puts you at increased risk for clots. Taking some forms of birth control pills with higher estrogen levels put us at increased risk for clots. So this is not something that's new to the medical community. If you have symptoms like really severe headache or swelling in your leg, like one leg, or really severe abdominal pain within the first 14 days of getting the vaccine, this is something that you should alert your medical provider to, and there is help that you can get. Now, next slide. So the question is it safe for pregnant women and breastfeeding women as well? And so a lot of trials, and not just the COVID-19 trials, don't necessarily include pregnant women or breastfeeding women. However, they are starting to do the studies on pregnant women. And it is not unfounded for pregnant women to get vaccines. For those of you who have been pregnant before, you know that the flu vaccine, as well as the tetanus, diphtheria, pertussis vaccine are absolutely recommended during pregnancy because that helps you form a response that then protects your baby. And it's no different with the COVID-19 vaccine as well. And given how the COVID-19 vaccine works, there's not an indication that this would be any higher risk for pregnant women than the 2 shots that are already given during pregnancy. Also for breastfeeding women, it has been found that the antibodies that you make, your immune system makes from getting the COVID-19 vaccine can be present in breast milk. So you are giving some protection to your baby as well. And I will say for myself, I am a breastfeeding mom right now, and I did get the vaccine, and I feel happy and glad that I'm at least giving some protection to my baby who's not qualified to get this vaccine. Also, we have not found any effects on fertility at all with the vaccine. People who have gotten the vaccine have gotten pregnant. Next slide.
Sorry about that. So like we've said before, there is hold on the Johnson & Johnson vaccine currently, but it is approved down to 18 years of age. The Moderna vaccine is currently approved down to 18 years of age as well. And Pfizer is approved down to 16 years of age. On April 9th, Pfizer asked the FDA to approve the vaccine to include adolescents 12 to 15 years old after the phase 3 clinical trials was found to be safe and effective. Pfizer COVID-19 vaccine was well tolerated and showed 100% efficacy in 2,260 children aged 12 to 15 years old. Results revealed no COVID-19 cases in the vaccinated group. Pfizer is now enrolling children 6 months to 11 years old, and Moderna has an adolescent trial in progress and is recruiting children 6 months to 11 years old for another study. Next slide, please. So what are some of the rewards of getting vaccinated? Well, firstly, those that are fully vaccinated can then visit other fully vaccinated people without your mask. You can also visit without your mask if you're visiting a household that have people that are unvaccinated, but they're low risk for severe disease. You can travel domestically without pre or post travel test. You can also travel domestically without quarantining after travel. You can travel internationally without pre-travel tests, depending on where you're going. And you can travel internationally without quarantining after travel. What's not recommended right now for fully vaccinated people is visiting those people indoors who are at severe risk for developing severe COVID-19 if they were to get sick, unvaccinated people, or attending large and medium-sized gatherings. Next slide, please. So this slide just represents that at this point, we have about 37% of the population that has been vaccinated with at least one dose, which equates to about 2 million, and then 23% have been fully vaccinated in the state of Minnesota. Next slide, please. From this slide, you're able to see that 41% of white people in Minnesota have been vaccinated, while only 23% of the Black community have been vaccinated. So it just shows that we have a long way to go, despite the gains that we've made thus far. Next slide, please. Nonetheless, while many African Americans are aware that the risk of contracting and dying from COVID-19 remains high, there's still many hesitancies and myths that exist, which we want to readdress and reiterate. So fact, once again, these vaccines will not give you COVID-19. These vaccines do not alter your DNA. The mRNA disappears quickly from the cells and does not enter your DNA or become a part of your genetic code. mRNA COVID-19 vaccines do not contain any live virus, microchips, tracers, stem cells, mercury, preservatives, or pork products. Fact, the COVID-19 vaccine is free, so you should not be paying any money for it. And fact, people who are pregnant, breastfeeding, or want to become pregnant can get vaccinated, but we do want you to consult with your medical provider. Next slide. So now I want to talk a little bit more about the vaccine, the common hesitancies that are heard. And for myself, my own experience, despite working in medicine, I have been discriminated against in healthcare. So I understand the level of distrust that exists in healthcare. And I also understand the reason for hesitancy around receiving the COVID-19 vaccine. Just like Dr. Donato, my reservation also began with the title of Operation Warp Speed, given by the previous administration. I felt that this meant that the vaccine was being rushed and corners were being cut. But once the vaccine was available, my hesitancy changed from the vaccine was created too fast to I don't want to be treated like a guinea pig. And after research, I was able to address my own hesitancies, and I hope that you're able to address your hesitancies as well. So the vaccine was created too fast. Again, I want to reiterate what Dr. Donato has already stated, that there were no shortcuts in the science with the creation of this vaccine. Clinical trials of COVID-19 vaccine were done with the same rigor applied to all vaccine trials. While SARS-CoV-2, better known as COVID-19, is a new virus, coronavirus is not new. There are several types of coronavirus, most of which result in the common cold. When creating the coronavirus vaccine, researchers were able to build on earlier research that was completed on previous previous coronaviruses, like SARS-CoV or MERS-CoV. And this research is anywhere from 10 to 15 years old. Furthermore, it is important to understand that the original research of the mRNA vaccine is decades old. This shows us that the science behind coronavirus is not new. It's been studied for decades. Knowing that the science is not new is reassuring, but I also have to reiterate that standards for approval remain the same. The vaccine must be shown to be safe, effective, and of high quality before people are able to receive it. It was additional resources, like we said before, that allowed researchers to complete all these steps simultaneously and speed up the process of creating the vaccine. Another common hesitancy, I just don't trust the vaccine. The messaging has been, give the vaccine to the most vulnerable population, the Black and brown people. This triggered something in me. Mistrust comes from a historical place. The infamous Tuskegee study of syphilis and the cell research of Henrietta Lacks both cast a deep historical shadow over the integrity of medical research involving minorities. Lack of confidence in the government and the historical wrongs of this country are not an issue of the past, as there are still current wrongs that are going on right now. So hesitant people have every right to have their reservations. Nevertheless, it is important to know that there are protections that have been put in place to make sure that history does not repeat itself and minorities are not being used like guinea pigs. There are organizations like the Office of Human Research Protection, which was put in place after the Tuskegee Project. There's the Independent Data and Safety Monitoring Board. There's the FDA's Vaccine and Related Biological Products Advisory Committee, or VRBAC. And there's the CDC's Advisory Committee on Immunization Practices, or ACIP. These are all independent organizations that have people of color on their committees working to ensure the vaccine is safe. Lastly, I think it's important to know that it was an African-American, Dr. Kizzy Corbett at NIH, that played an instrumental role in the development of the vaccine. It was her research that suggested that mRNA could be used to fight COVID-19. Another common hesitation, I want to wait it out and see how others do first. This wait it out and see approach only prolongs our ability to reach herd immunity. Herd immunity means that a large part of the population needs to be immune to COVID-19 so the pandemic can end. We need to get 75 to 80% of people immune to the virus in order to obtain herd immunity. Immunity is obtained by either getting vaccinated with COVID vaccine or contracting COVID-19. We know that contracting the virus is dangerous and can be deadly, but the vaccine is a safe and effective way to obtain immunity. Not only does the vaccine keep you from getting sick from COVID-19, but it's a safe way to help build protection and an important tool to help stop this pandemic. Furthermore, waiting is risky as COVID-19 and new variants continues to spread. Currently, the vaccine seems to protect okay against the variants, but we must remain vigilant to do our part and practice social distancing, wear our masks, practice good hand washing, and most importantly, get vaccinated. And lastly, we commonly hear, I don't get the flu shot, I just don't get sick. I don't think I need to get the COVID vaccine. While the choice to get vaccinated is yours, it is important to remember that the flu virus is annual and people get really sick from the flu. About 40,000 people die annually from the flu. COVID-19 has proven to be much more deadly, with almost 3 million deaths worldwide since the start of the pandemic. Healthy people have been suffering greatly. And again, the vaccine is currently not recommended in all age groups. So you don't want to risk getting sick and then passing the virus to those more vulnerable groups and children. Next slide. So on March 30th, Minneapolis expanded eligibility to everyone over 16 of age to get vaccine. We've listed here some of the locations where you can find the vaccine, but remember, COVID-19 is devastating the Black and brown community. Don't miss your shot when your time comes around. If you don't want to do it for yourself, do it for your family, do it for your children. Thank you.
guests. We welcome any questions you may have for our panelists. Vaccine, about the COVID virus, about the FAQs, and about some of the myths about any of those topics. I do have a question for both of our panelists, though, if I can get it. What is the most common objection to the vaccine that you've heard from your patients in your two clinical practices? Shannon listed many of them. What do you seem to hear the most, and how is there one question that stands above the others as an objection to the vaccine?
You want to know like side effects from them getting the vaccine? I'm sorry.
Most common objection to the vaccine.
Oh, objection to getting the vaccine. I'm
sorry, I might have been partial.
No, it's okay. So mostly what I'm hearing is just it just seems rushed, so they just don't trust it. I think that's mostly what I'm getting as far as pushback. I do hear a lot of, I don't get the flu shot. You know, I do hear a lot of that as well. But right now, I think people just want to understand how were we able to come up with it so fast when we say that, oh, vaccines take 5 to 10 years to create, you know, and so really trying to get the information out there about the science and how we've been studying this for such a long time. Helped us to expedite this because we wanted to be prepared to have a way to get a vaccine out fast when something did happen. And so we were better prepared for that. So I would say that's what I'm hearing.
I would agree with Jen, and the biggest thing that I hear, the biggest thing that I hear is this came out way too quick. I don't know about this one. Do they really know? Do they really know if it's safe? So I think that's a fair question, quite honestly. And that's why I did all the back research, looked at all of the studies that came before even the trials came out, so that I could have an informed response for my patients and give my real recommendation. So yeah, it's too new. That's the one that I get.
Scanning the chat for other questions that our attendees may have, and I am not seeing anything come through yet. And folks who are attending, is there anything you'd like to tap into the chat panel as a question or comment to our two advisors? I apologize, I may not have had that turned on, but I believe I just turned on the chat panel for everyone. Is there anything else that we could enter into the discussion with you about? Anything you're hearing from your students, from your fellow faculty members or staff members?
I guess I can give my my personal experience with getting the vaccine and also my husband's experience. So I got the Pfizer vaccine that's offered at Hennepin Healthcare. And with the first shot that I got in my left arm, I definitely got the soreness in my arm. For about 2 days, it hurt. I definitely took some ibuprofen, but then the pain went away. I didn't have any chills or fevers or anything like that. And then with the second vaccine, I had soreness for maybe half hour and that's it. Now my husband didn't feel anything the first time, had soreness for a couple hours in his arm. And then with the second shot of the Pfizer vaccine, he did get some chills and fevers and body aches. And he was in bed for a good maybe 8 hours, and then he was fine after that. So The side effects are real. So just so you go in with eyes wide open. And again, they're common side effects that a lot of my patients have told me about with getting other vaccines as well. And for anybody listening out there, there is not a stupid question. So if you have it, just ask us. That's what we're here for.
Can I add one more common misconception?
Absolutely.
I'm working in the community to set up community vaccination events at churches, community centers, and around the city and the county. A common misperception among many potential people to be vaccinated is that there is a fee and that there will be an out-of-pocket cost. And in every one of those events in which I do the intake work with community groups and communities of faith, the question does come up. And the answer is no, we are not charged by the federal government or the state of Minnesota for the vaccine doses that we receive in our allocation. And while your insurance information may be collected at the time of vaccination, you will never receive a bill. We understand that the insurance companies are able to reimburse us a small amount for administering the vaccine, but the patient will never receive a bill. And that is a common misperception that folks have, that if they come to a vaccination event hosted by the state or by a faith community or at a Minneapolis Public School where we have done many vaccination events, there will be a fee, and that they must present a form of payment. And no, that is not the case.
Yeah, if there's anybody online asking you for money before you get up to the front to get your vaccine, please don't pay attention to them. You should not be paying anybody for this.
And you don't have to have insurance either.
No, you do not. Correct. That is absolutely correct. You do not. We do believe the insurance companies will be very interested in reaching out to their members who have not been vaccinated as we get deeper into the year, but those efforts have not started yet because even though we've made great progress, it's a very tall hill to climb.
Yeah.
And we have verified that the chat does work. Thank you, Doctor. We just wanted to make sure that all of you out there in the schools can hear us and can be heard. Here we go. Can everyone see that question in the chat box? Can you speak to the safety of in-person learning is there anything that young people should keep in mind to keep themselves and their families safe?
You know, I think right now the goal is to get teachers vaccinated, but for your student that you're sending to school, your children, talking to them about what learning may look like right now, because I know many of the kids are just itching to get back into school, but it's just going to look a little different. And it's not going to be right away that we're able to vaccinate all ages. You know, I do believe this is going to be probably in stages right now, like I said, down to 12. And then after that, it may be, you know, stages. I'm not sure exactly how they may break it down, but the importance of hygiene, so hand washing, good practice that they should have been doing this time, but reiterating that. And then really the importance of wearing their masks. So keeping their mask on and trying to social distance. And for the parents, if your children aren't well, keeping them home. So that's going to be the best way that we're able to keep the schools open and keep the in-school learning process happening, because we know that lots of students have suffered with this distance learning. It's not working well for many children. And we don't want to continue to widen this education gap that we're creating during this pandemic. And so I think it's imperative that we get the kids back in school, but we do want to do it in a safe way. And so kind of talking to your own children on what that needs to look like, I think is important, but also doing your part if you know that they're not well, making sure that they're tested before they're sent back to school.
And that's not to say that there's no risk. What I've seen is that surprisingly, kids are better at following these instructions than adults are, keeping their mask on and over their nose, kind of keeping their hands to themselves, type of thing. One thing that does concern me is that as we're trying to get more people vaccinated, the variants are coming out that are affecting more young people. So we'll have to see. We'll have to see how the rise of some variants affects young people going to school. But as of right now, as long as we have these safety measures in place, I think that the benefit outweighs the risk currently for kids to do some in-person learning.
Thank you both. And I just want to encourage all of our guests, you have two providers completely to yourselves, a 2-to-1 provider to guest ratio, which is extraordinary in these times of medicine. If you do have any questions, be selfish. Providers here for another 10 minutes with no distractions, and there are no other appointments. They don't have any nurses saying, "Oh, you better come see this doctor," or any of the same. So you have them all to yourselves. We encourage your questions.
That is true, and a rare moment.
Well, we're at about 9 minutes to the top of the hour. I'll ask a final call for questions from our guests. And here we go. A question from Michelle. Do you have information on how quickly vaccines will be available 12 and older?
I believe that they are asking for permission very soon here. So that they can go ahead and get the go-ahead to vaccinate down to, I believe by the fall for sure that the down to 12 will be vaccinated or approved for vaccination before the start of the school year. For Pfizer, yes, I do believe. The efficacy rate was 100% in the children. So none of those children were known to get sick. And it was over 2,000 that was entered into that trial. Thank you.
Another question. Have we had a large number of children hospitalized for COVID-19 at this time? And can we interpret at this time to mean over the course of the pandemic as well, or right now? Well, I'll ask our two panelists to answer right now. Thank you. Okay.
You know, we know that in general, COVID-19 doesn't cause serious disease in children. So it's been a very small number of those hospitalized. And so when you do think of the hospitalized, you are thinking about the very vulnerable. So the really, really young, you know, I've had I think she was maybe as young as 10 months old that was hospitalized for COVID-19, just because their lungs and the bronchiolitis that they get in their breathing, it makes it hard for them. But for the most part, the children just kind of seem like they have a really bad cold, and can stay at home and get supportive care at home. So I would say I don't have a number, but it's not a large number. It's very small of those when you think about how sick children get. I think the bigger concern is the children giving the virus to the adults who can get really sick and die, but not so much the children dying, while there has been a rare occasion that children pass away.
Another question, and thank you for this as well. Should we be concerned about schools open at this time? High school and middle school specifically.
Children make up about 20 to 25% of the population. So we are going to have to include them in this process of vaccinating when we talk about herd immunity and trying to get back to some level of normalcy. So I do think that the goal should be getting them vaccinated. Now, while opening the doors of the school is important, again, I do think we have to look at the risk and benefits of that. There are some populations that I think that in-person learning, it's very important and they just thrive better. But then there are other populations that can do okay with distance learning. And so you have to kind of find that balance, which I think that right now schools are allowing parents to have input in that process, which I think is helpful. But once we've decided that the schools are open, then we want to ensure that, number one, the teachers are vaccinated that are in the schools, and then that we have these precautions in place. If we have precautions in place, then I think that the risk of spreading the virus in the school is low, because schools are very controlled environments. For the most part, you're controlling who's coming in, who's coming out, you know, that type of thing. And so because you have that level of control with the schools, as long as we have policies in place and we are making sure they're being adhered to, I do think that the risk of transmission in the school is low. And I think that we can open schools in a safe way.
The long haul syndrome. Have you seen children and teens long haul syndrome? I'm sorry, children and teens who acquire long haul syndrome, and are you concerned about the variants that are ever evolving?
Yes. So the B117 is the variant that we've seen in children. And I think a lot of it has been through these sports. So when they're doing soccer or whatever team sport that they're doing and allowing them to kind of continue playing these sports, we're seeing a lot of the spreading of the variants that way. And again, I want to reiterate, right now, the vaccines are working okay against that. But like we said, as long as they're a live host, there's an opportunity to yet create another mutation. And so we don't want this to continue to happen. And then now we're talking about boosters because then the pandemic kind of keeps going. And then as far as the long haul portion, yes, there are like long haul symptoms that can happen with children, as does adults. Right now, we don't know what those effects look like overall. I will say what we found in adults getting vaccinated who have had long haul symptoms, like they've had coronavirus and experiencing long haul symptoms, that getting the actual vaccine helped with those symptoms.
Is this event recorded? I'm a school nurse and would like to share this information with my students and families that could not participate today. Yes, it is. And I will ensure that we get you a link. Thank you for asking that question, and thank you for being willing to share it. I have a question for Dr. Nanton, and I'm wondering, as we look at this particular slide and about the accelerated process, can you comment on the difference in the gray box for manufacturing and how that has been so unprecedented from other medicine development, and why they've added so much speed to this particular development? Because I think it's when we talk about the myth.
Right. It's actually quite interesting and fascinating. There are people who have learned in the scientific community and in the manufacturing community from our past almost pandemics. When we were worried about SARS virus coming in the early 2000s, and when we were worried about Ebola coming over to the United States, there were people in science, in the government, in manufacturing who were like, we don't want to get caught essentially with our pants down. We want to be prepared. So if there was an article that came out in December in USA Today that profiled some of the key players in the Moderna vaccine that said they were developing a ramp-up process through Moderna for a different vaccine, and they were waiting for funding and the red tape that I was talking about. But then when it looked like we were going to have this virus, the coronavirus, spread all around the world, they asked the people who were giving them funding, you know what, can we scrap this process for that other vaccine, and can we apply it to this? We need this one right now. So there were already things in the works to be able to ramp up a vaccine safely. And I guess it was just at the right time. If this happened 5 years ago, we wouldn't have been prepared.
Thank you, Doctor. And was there not also a fourth and a fifth that were in development that did?
There were many others that were in development that I'm not even sure where they stopped in the process. But if they're not safe and if they're not effective, according to FDA and CDC, would be protecting at least 50% of the people who got the vaccine, then we're not seeing them. So they're taking this really seriously.
We're seeing those that made it to the accelerated finish line.
Exactly.
And manufacturing before licensing, betting that it'll work is really unprecedented in the manufacturing world. But I think that should give everybody a sense of the urgency. We're
exactly.
Over time, and I know our friends from public relations will see that the link goes out on Facebook and our YouTube page for further viewing. I want to thank all of you who've joined us, and I particularly want to thank all of our panelists who were giving up time during a very busy pandemic to spread the word and help educate all of us. I certainly learned plenty on this event, and I thank everyone. Stay safe and have a wonderful day and a wonderful rest of the week with your students and your patients, everyone. Good day.
Thank you.
Stay safe, everybody.